This is Neily on Nutrition. I'm with Bridget Swinney, author of Eating Expectantly, coming out in 2013. We talked about risks for somebody, a woman being overweight, and what she can do in a previous video. So let's talk about a healthy woman. She gets pregnant. What can she do to maximize her nutrition and the health of the baby before it's born?
Well, for all women, they should really strive for a nutrient-rich diet. So that means one based on whole grains, fruits and vegetables, and healthy, lean proteins. Now, one thing that I find is that doctors often tell their patients not to eat fish because some fish are high in mercury, but actually eating fish is a really healthy habit to get into. And what's recommended is that you try to have at least, the maximum of 12 ounces of one of the low mercury fish, such as salmon, tilapia, shrimp. Those are really healthy fish to eat while you're pregnant.
What about canned tuna?
Canned tuna is one of those things that it's not considered extremely high in mercury, but it's not on the low end either. So if you're going to have tuna, my suggestion is that you have it no more than once a week. The albacore tuna, the white tuna, does have more than the light tuna. Now, the fish that women want to avoid would be the shark, swordfish, tilefish, and king mackerel. And actually, one of the things I recommend is a website, an app called Fish for Health that can help you track what fish are the healthiest to eat and also keep track of how many ounces of fish you're eating.
Fishforhealth.com?
.net.
.net, okay, great. So eating fish, a plant-based diet, what else can a woman do?
Well, they want to really gain the right amount of weight. That's really key for everybody because, you know, most women, the eating for two myth, it really goes to everybody's head. So everybody just thinks, I'm pregnant, I get to eat what I want. And that's not true. And it's really easy to go overboard. The truth is you really don't need any extra calories during the first trimester. And because you really should only gain 2 to 4 pounds in the first 3 months, which is not very much. So generally I recommend that people just follow their appetite. That don't let the eat for two go to your head, but just increase the servings of the healthy foods, like an extra serving or two of dairy products, a couple of extra servings of fruits and vegetables, and maybe a little bit more protein, and then you really have all the calories and nutrients that you need.
And how much, again, should a woman gain?
For a normal weight woman, 25 to 35 pounds.
And somebody that's overweight?
Somebody that's overweight, it would be 11 to 20 pounds.
11 to 20 pounds.
And unfortunately, there's not a recommendation for obese women. So that recommendation should really come from a woman's physician.
Okay. Good advice. Thanks so much, Bridget.
Thank you.
Bridget Swinney, author of Eating Expectantly. This is Neily on Nutrition, and we'll see you in the next video.